Welcome back. With escalating Medicare costs both locally and abroad, health practitioners and industry players meet in Kampala next week to showcase latest developments in the sector they say could tame the costs and the reverse, or a trend rather, where some patients from the region have to be flown abroad to seek medical attention. In the process, and as detailed in the following feature, organizers of the Medical Expo hope to open up a whole new window of opportunity for regional tourism.
At least 25 Kenyan exhibitors, alongside 10 from Uganda, have confirmed participation in the first ever Medical Expo planned for Kampala, Uganda from the 28th of this month to the 1st of May. This will be the first time local providers of healthcare services have come together to showcase advancements in the area of medicine, both in terms of skill sets and infrastructure that have been attained over the last couple of years.
I think it's very timely to have the East African Health Expo at the end of this month. Simply because there's been a growing trend in the medical tourism and the travel industry. Several East Africans have been traveling out of their countries to seek for healthcare services. They prefer to go to India, some prefer to go to the UK and some to South Africa.
All major private hospitals, referral hospitals and associated service providers have confirmed participation in this area that is turning out to bear huge potential for the country, that of a medical tourism.
In the last decade, a huge amount of investment has taken place within the health sector in the region. Kenya notably has been leading the pack in terms of its high-end healthcare services. The quality of services have been improving in Kenya, and the number of specialists have also been growing in Kenya.
Now this capacity is not found much in the rest of East Africa, and therefore Kenyan doctors have to open their services to other East African countries.
The exhibition is then expected to become rotational, being hosted in turns by each of the 5 East African countries once every 3 months.
The reason why we are having this expo, so that we can unearth and find out what are the key strengths and the recent investments in the healthcare industry in these countries. And once we do that, this information then will be shared. We hope that this exercise will culminate in a formation of what we call the East African Healthcare Federation.
Besides discouraging residents from traveling abroad to seek medical services, the outcome of the expo is expected to increase investments in medical infrastructure and push down the cost of Medicare because of the resultant competition.
We want any Kenyan who feels like going to India, before you go, call us, and we will be able to provide you medical services that are very, very affordably priced.
From years of experience, countries like India have perfected their skills and refined supportive services like procurement, developing high-class services at very cost-effective rates. The collaboration between medical practitioners in the 5 East African countries is seen as a formidable strategy to develop medical services in the region, learning from each other's experiences and mistakes, and in the process, optimally harnessing the region's key competencies and comparative advantages. In its 4 years of existence, for instance, Karen Hospital has built a reputation around open heart surgeries, successfully conducting at least 40, besides other previously uncommon procedures in the country like cosmetic surgeries.
This week, we did the first ever open heart surgery on a beating heart. Usually, traditionally, when doctors are operating on a heart, they have to stop it first to fix it. But we conducted the surgery where the heart was beating, and we operated on it. So we have major milestones that we have achieved so far.
I think the super specialty areas that we're doing extremely well on is pediatrics, obstetrics and gynecology, neurosurgery, orthopedic surgery, and I think a bit of cosmetic surgery and plastic surgery.
In the end, citizens of the region should come out as the beneficiaries.
The biggest success factor will be inclusiveness. If we get inclusiveness from the member states, that will be a good measure of success. The second thing is open partnership between providers who have certain strengths. So if I have a heart and cardiac center, I should be able to work with several doctors and providers in other countries where I can support them with my services and give them a feedback and the patient can go safe and healthy back to their home and be productive.
We are going to interact with fellow doctors. These are doctors who have invited us to come and talk about what we have and how they can be of use to us and we can be of use to them. So it's a partnership, because even they are doctors out there and they're also very well skilled, but they may not have access to such large infrastructure. And so for us, it is bringing the East African community closer together.
The Medical Expo aims to attract at least 150,000 visitors.